Hey everyone, Carrie Abbott, and I direct the Office of Homeless Care and Coordination. I was thinking back this morning to the last time I was in person for a big COC meeting, and I think it was here upstairs when we were kicking off the systems modeling process, which would sort of give us the information, our needs analysis, as we thought of it, for how we needed to structure our homelessness response system. At that time, OHCC did not exist yet, and we were embarking on a huge journey. And she's not here today, but I wanted to remember that Susan Shelton stood up in the middle of the system modeling presentation and said, "How is this centered in racial equity?" And I think that that question really changed the course of everything that we did in our centering race equity process, which is what the system modeling became, and then in the Home Together strategic planning process, which followed. And so just, taking a moment to say that was just 4 years ago. There's been a lot of planning, there's been a pandemic, we've come a long way. And during all of that, as a shout out to the service providers in the room, we have kept going. We have brought thousands of people inside during that time. We are not just planning. We're not waiting to implement. We are doing, we are learning, and we are doing better as we go. So thank you so much to all of you. All right, so now the glamorous topic of the year one update of the Home Together strategic plan. So Home Together started with our community. It started with the Centering Racial Equity in Homeless System Design report. And so that was a really great racial equity impact analysis on our systems data in Alameda County. And so we took that and said, okay, now what? We need to implement, and how do we implement in a way that does center racial equity in in service of ending homelessness? Because as Darlene pointed out earlier, we cannot end homelessness in Alameda County without centering racial equity. Um, so we started with prevention. This is where homelessness is most disproportionate in our community. The number of people becoming homeless in Alameda County continues to exceed the number of people we are able to house, and it continues to be the most disproportionate part of our system of care. And in the last several months, the last 6 months to be precise, we've hosted a homelessness prevention strategy team to really supplement the work of the Home Together plan. That's not part of the year one update, but it's just completed and will result in an addendum to the Home Together plan. And thank you, Ms. Shalene, for the, for the thumbs up there. Thank you for the participation from a lot of you here again. So the first goal is preventing homelessness, addressing racial disparities in our mainstream systems, and preventing racially disproportionate inflow into homelessness. The second, of course, is to connect people to shelter and needed resources. We've been tasked with rethinking that, with not making it this great big funnel and hoping that a few people will get through. We've been tasked with getting out into the field. We've been tasked with finding people where they are and figuring out what is going to work to help them come inside. And it's a different frame. It's looking for exits from homelessness that have dignity, where people can bring property. It's looking at easy processes, and it's looking at getting people the resources they need, having the pathway that is specific to the person experiencing homelessness. And then further, part of that is we don't have enough interim housing. We don't have enough places for people to exit to that provide that level of dignity and support that people need. Our third goal, increasing housing solutions. This is a big one. This is one of the reasons we have a housing capacity committee starting. Thank you for all of those who are going to be part of that. building new units for housing, but also getting new subsidies into our system and really kicking off the dedicated affordable housing strategy that we envisioned when we worked on that centering racial equity report, figuring out how to give people the type of assistance they need to be able to obtain and maintain housing. And then the fourth goal is strengthening the coordination, communication, and capacity of our system. This is about strengthening our coordinated entry system so it is accessible, but it's also about strengthening the capacity of our service providers, getting our career pathways built into this industry so that people can come in if they've been homeless. We can build on the skills, on the knowledge, on the expertise that people bring to us, and that there's a career pathway within the nonprofit organizations and within our government agencies. So we started the Centering Race Equity process with focus groups, with interviews with people with lived experience. The quotes on this page, and I'll just stop to say that Jen Lucky's in the room and back there, and is the keeper of all of the Home Together documents. We'll have those available in the chat. And if you have other questions about the year one update and other things, please ask Jen. The focus groups have been extensive and the meetings have been extensive, and some of these quotes in here are truly, truly impactful, and there are a lot more in the Centering Race Equity report. So, but yeah, sorry, I see what you mean, Simone, about reading the screen. So we looked at the system needs to drastically reduce homelessness and racial inequities in Alameda County. We calculated that we needed over 24,000 new housing supports. These are not all housing units. A lot of them could be housing subsidies. A lot of them could be shallow subsidies to help people stay where they are. But it's 24,000. It's a huge amount that is needed, especially for permanent housing. We also calculated that we needed an increase in funding for shelter, and this does not include the capital cost. We're going to talk about the housing bond later today. This does not include the capital cost of building the housing. This is for the subsidies, this is for the shelter, this is for the supportive services. This is what happens if we don't do it. If we continued the current trajectory as of 2019, 2020, that red line that's our nightmare. I mean, that is where more and more people are becoming homeless and do not have an exit from homelessness. The purple line looks a little better. That's probably about where we are right now. That is where we've invested a little more. We have started to focus a little more on prevention. We've expanded our system. But it's not going to end homelessness without significant new resources. The orange line where we want to be, that's if you invest the resources we need, the $2.5 billion, like we have to just say it. If we invest those resources, then that's where we would get in 5 years, is nobody having an unmet need. We know people will still fall into homelessness. We know that people will still lose their situations. But if we can respond to that quickly and have an option for everyone who does, that's where we want to be. So in order to look at how we're doing after the first year of this report, we looked at what our inventory changes were, how we were doing in meeting the goals and key systems measures, and what the investment looked like so far. We pulled data, of course, from the Homeless Management Information System, which is a database that most of our providers use, but we also looked at the point-in-time count. We looked at data from the county agencies, from the cities participating in the Home Together plan, and the service providers. So, in terms of goal one on prevention, even with the eviction moratorium, we still saw the number of people becoming homeless outpacing the rate of people exiting homelessness into housing. Why is that? It's mostly because the people who become homeless were not most recently in a place where they had their own lease. That's about 25% of the people who become homeless. Usually people have lost their lease or never had one, and they've been living with friends or family. They have been in challenging places, but places with a roof over their heads. And it's at that point that they became homeless. We know from the point in time count data that 16% said that they became homeless as a direct result of COVID in our last point in time count. So we know that even with the eviction moratorium, that was not enough to keep people who are extremely low income from ending up experiencing homelessness. We also found that we see that continued disproportionality of people who are African American, people who are Native American, and Hawaiian people in particular are disproportionately represented among people becoming homeless. So, in our prevention system, looking at that disproportionality is really, really critical. We did, as you can see on the screen, see some really great programs launched within our cities and within the county. Starting the CalAIM Housing Navigation and Tenancy Sustaining Services has been a tremendous add to our community. We were able to add 2,000 new services slots that we can build to Medi-Cal. That is no small feat. And thank you to the providers here who've been implementing that and building their capacity to be able to take that on. We saw specific eviction prevention and rental assistance programs in many of our cities. We saw some new shallow subsidy programs on pilots and some new guaranteed income programs on pilots. So goal 2, in terms of connecting people to resources, we went from 5 to 11 coordinated entry access points, and we'll shortly be launching the mobile access points for people who are unsheltered. There are new services in Santa Rita, new services to connect former foster youth to dedicated, rapid, and supportive housing, and access to shelter and needed resources being expanded throughout the county. There are new tiny homes, new drop-in centers, and new street outreach and street health teams. Next year, or in 21-22 or 22-23, our hope was to launch additional and more flexible resources and capacity to expand the housing navigation and access points, to increase our behavioral health and supportive services to help people in permanent housing maintain their housing, and to increase our crisis response services. In goal 3, increasing housing, we saw many hundreds of new housing subsidies deployed in our community. Thankfully, because the emergency housing voucher program was funded through HUD to be able to assist the people who had been in our Project Monkey hotels and sites to move directly into permanent housing with a subsidy. And again, like so many compliments to the providers in the room for making that happen. There were more than 800 referrals in the first year for the emergency housing vouchers, and sneak preview for the year 2 report, we overleased. we placed more than the 875 vouchers in the community, and we've ended up bringing the housing stability vouchers from the next year's HUD allocation to provide those additional subsidies to make sure everyone who moved out was able to maintain a permanent subsidy. We saw the cities of Berkeley, Oakland, Livermore, Newark, and Fremont put dedicated funding towards supportive housing. And we saw new supportive housing for medically frail and elderly awarded in Hayward, and the cities of Pleasanton and Fremont funding new rapid housing programs. In the next year, the goal is to expand the supply of supportive housing subsidies and units to scale. This is a really big goal. You guys saw the 24,000 number. And to create the dedicated affordable housing for people who don't need intensive services. And then finally, to have enough new slots of rapid housing for those who can pay full rent over time and the supports to help them get there. In goal 4, in terms of progress, we saw that the temporary shelter programs grew to 121% of the targeted goal. So we did exceed that goal in the first year. We still have FEMA resources at that time. So that will not look as good in the second year. And in terms of funding, we still were in the situation of having most of the funding in our system be non-recurring. So one-time or time-limited funding. And in terms of data in our strengthening our system capacity, there have been a lot of efforts to improve data, both within the HMIS team and outside of the HMIS team. I'll show you a preview of the data page at the end here. It is now, it's live, it's usable. You can filter by demographics, you can filter by gender, etc. And it's great. It's still a work in progress, but it's a lot of progress. We also are looking at increasing the funding to HMIS to improve our coverage and providing additional career and financial support for people with lived experience in homelessness and supporting providers in recruiting and retaining staff as next steps. So some of our key takeaways. Our takeaway number one was that our system capacity really expanded in the first couple of years of this plan. The homelessness response system served 25% more people in 21-22 than the year before that. And $576 million was allocated in Alameda County towards system inventory and operations, close to 1,900 permanent housing opportunities and 1,500 crisis response units were added to the system in that year. Takeaway number two, we're still seeing that new homelessness outpaces the placement rates. 4,033 newly homeless people entered the system in 21-22, and 3,000 moved from homelessness into housing. That's a huge lift to move 3,000 people in a year in housing, and it's not going to do us what we need unless we stop people from becoming homeless or stop people from losing the housing we place them in. Takeaway number three, we're still seeing obviously racial disparities in the system. These are the comparative bar graphs here from 2021 to 21-22, and the percentages remain really consistent despite having modified coordinated entry, despite having targeted resources for people from the room key sites where we did see racially proportionate populations. Takeaway number four is that lack of funding is stalling key activities. I know that was a surprise one, but we did not see the influx of local funding that we hoped to see in the first year of this plan. I know you all voted for it, and it is not available at this moment. Our takeaway number five is that we need more sustainable resources. It is really hard to, if you are a service provider and I come to you and I say, we have $500,000 for a program. It's exactly what our system needs, but it's only going to be for a year and a half. It's just you can't keep trying to operate that way. And certainly our voices, I believe, are being heard in the state of California. And we're very hopeful that sometime in the next couple of years we will see a more sustainable source. So some of the inventory results from the first year. So first of all, in terms of what we projected we would do or what our goal was and what we achieved, we way outdid ourselves in terms of housing problem solving and rapid resolution. We had some flexible resources that our housing resource centers were able to deploy to help people quickly to help get them back to the last safe place where they had been or to a place that they could move to quickly without needing to even move into the shelter queue or move into the housing queue. Our crisis response, our emergency shelter, transitional housing, safe haven, we exceeded our goals. We got to 121% of the goal by sheltering more than 3,000 people. For transitional housing for youth, we were able to get to 112% of the goal in year one. Rapid rehousing and supportive housing, we were in the mid-90s, not bad. Unfortunately, when you get to the dedicated affordable housing, we got to 32%, and that was only because of the emergency housing vouchers we were able to place in that year. This is something that absolutely requires a new revenue source. and it is one that we do not have moving forward. Similarly, with shallow subsidies, we had a few privately funded or locally funded shallow subsidy programs, and we do not have a sustainable source for this yet. So here's where our investments went from the $576 million in year one. The inventory program, so this is diversion, rapid resolution, crisis response, rapid rehousing, supportive housing, dedicated, affordable, and shallow subsidies. We spent almost half. We spent $253 million. Similarly, we spent $254 million in capital investments. That's part of crisis response, dedicated, affordable, and supportive housing. And then we additionally spent $68.8 million on eviction prevention, street outreach, and administrative infrastructure, and funds that had not been allocated at the time of the end of the report. So this is what the investments look like compared with the targets. So the year one goal is the blue bar. You can see in most of the areas we came pretty close. The year one actual was the orange bar, and this is just for the dollar investments, not the unit numbers. The funding by source, the state in 21-22 funded 64% of the homeless response system resources. Local funding was $86.2 million at 14.9%, and federal funding at 20.6%. This is a really big deal for those who've been working in this field for a long time, because it used to be that HUD funded the majority of our services. So some of the key system measures, the number of people experiencing homelessness went up. Our baseline year was really not 2021 because we did not have a homeless count in 2021. It was prior to that, but our year one count was 9,747. That was at the beginning of 2022. The number of people served annually, so people seeking services within the homelessness response system went from 17,000 to 21,000 in just 1 year. The number of people served annually enrolled in housing programs went from 5,000 to 6,300. Number of people who became homeless for the first time went from 3,400 to 3,600. And the number of people who gained housing was over 3,000 in both years, but not as many in 21-22 as in 2021. And then finally, the number of people returning to homelessness within 2 years was really static. We did not see a big change. Given that it's the number, not the percentage, it's actually a decrease in the percentage returning to homelessness, but it's still way too many. So some of the priorities moving forward with the Home Together plan in particular, looking at programs and activities that can reduce racial equities, looking at really targeted prevention to decrease our first-time homelessness and returns to homelessness. We're looking at accelerating the process of people getting into housing. So trying to take that from months to hopefully weeks or days. We have a concept right now with our unsheltered NOFA funding that we are seeking to provide zero barrier housing so that people who are unsheltered can be moved directly into housing units. Expanding our shallow subsidy and dedicated affordable housing inventory. We know it's going to take an influx, and we can be creative when we have funding that is flexible. This is something that we can use it for. Our housing team is looking to use some of the state funding that is flexible, and some of the health plan funding that is flexible to turn that into operating reserves or to housing supports that can help us expand these programs. Improving our data quality and accessibility, and of course expanding our shelter, and I wanted to say our shelter with dignity to reduce unsheltered homelessness. For our next update, we're hoping to improve the data quality and our housing inventory count to streamline our sharing processes and to improve our data collection tools and processes, just to give a better picture, just to be able to communicate better about what we're doing, what's working, what our challenges are. So there's the questions or comments, and then, oh, I wanted to go to the data page. But I'll pause.
Hi, I just wanted to clarify, under the category of housing problem solving and rapid resolution, would that include the deep cleaning and evictions?
No.
Hi, in the data, it showed PSH and rapid rehousing decline actually in enrollments on that second to last slide that you had, yet the investments hit or exceeded. Can you say more about why you think that is?
Sure. Some of the investments, we, as you know, that was Vivian Wong from Abode Services. Some of the investments were home key grants where the funding was deployed, but the site was not yet converted or opened as permanent supportive housing.
We have a question over Zoom. In the investment breakdown, what is TBD?
Thank you. So TBD was, for example, there was state funding called Homeless Disability Advocacy Program. And if we had not yet allocated it to a particular purpose, even if we were working on allocating it to new housing operations funding, it had not yet been allocated, so it was counted as TBD. One of those lovely government categories.
We have one more question over Zoom, and this came in during the first half of the presentation. Does that mean OHCC manages all grants and programs regarding shelter housing and services in the county?
No way. No, what OHCC has done over the last 4 years really is to try to consolidate the coordination of those services. And so, for example, healthcare for the homeless was in a separate department from our coordination work, our coordinated entry work, and some of our shelter and housing services. So we brought that in. And then the Housing and Community Development Department previously held the collaborative applicant role and the HMIS role. And so those were also brought over into OHCC along with our friend Riley Wilkerson in the back of the room, who everybody has known as associated with the COC for many years. So that was within the county, a lot of consolidation over the last couple of years. And in collaboration with the Continuum of Care and the Leadership Board, we've been working together to try to define roles and responsibilities and to really break those out. And so OHCC plays a large funding and coordinating role, and the service providers and housing developers and housing providers in the room are providing the shelter and the services and the housing in our community.
Hi, Kerry. Maybe about 3 or 4 slides from the end, the slide that had the PIT count numbers and the number of families served. I just want to talk about from like a system standpoint and community engagement standpoint, how we talk about homelessness from a point in time number perspective versus a number of persons served annually perspective. So you're looking at like at least 2.5 times the number of people counted in the point in time count being the actual number of persons served. And it seems like the number of persons served would be what would give us the truest big picture in terms of what homelessness or the crisis looks like, but our data generally uses as a reference point the point in time count as one thing. And then I observed too, in the third row, in terms of the number of persons served annually who are enrolled in a housing program, it's like a substantial increase in the number of folks in the other housing programs served in year one versus the baseline year. Like, what's behind some of that?
So first, I want to say you're 100% correct about the difference between the point in time count and the number of people served. And that was something that in that centering race equity process, in the systems modeling process, we really wanted to dig into. Is we've never thought that the point in time count is a full and accurate representation of everyone experiencing homelessness in Alameda County. And I mean, our family providers in the room know how many hidden families there are. Our domestic violence, gender-based violence providers know how many people our visual count will never see in our system of care. And yet many of those folks are seeking services over the course of the year. The other thing I think it reflects is that people come in and out of homelessness over the course of the year. The 9,700 is way too high, and it's nowhere near the number of people we will see across the course of a year. In terms of the other housing programs versus rapid rehousing and permanent supportive housing, so we did a lot. There have been changes in how we gather data, but there also have been a lot of people served in the shallow subsidy and the sort of dedicated affordable. And so some things got kind of classified as permanent supportive housing and some as dedicated affordable. It's a little bit arbitrary. They all have services, and there's really kind of a continuum, if you will, of services. But we really branched out as the, in the second and third years of the COVID pandemic to try to be creative, to try to figure out other ways for people to get placed in, scattered sites where we could provide ongoing economic support that might not fit our traditional categories.
All right, we've got two more folks on deck, and then I think we will have to shift into the next part of our agenda.
Thank you. Hi, my name is June. I'm looking at the numbers of people that are cycling in and out of homelessness, and my comment, I'm not going to say question, but my comment is about that. And oftentimes what we see is that people who cycle in and out of homelessness often have severe addiction issues or mental health issues. And many of them don't have the capacity to remain housed because of just paying rent every month, and I'm wondering if there's any way that the county can initiate some type of payee program for those people who have cycled in and out of homelessness, who just don't have the capacity to pay their rent regularly to remain housed, because often that is the issue.
Yeah, I think that representative pay services absolutely exist in Alameda County, and I think that voluntary representative pay services or money management programs are pretty small. That absolutely is something that we could build on. And I also want to note that there are a lot of resources coming on in 2024 that are really specifically geared toward behavioral health bridge housing and more intensive services in housing to be able to better serve people who are challenged in that way.
Thank you.
Thank you for your information so far. It's been very enlightening. My question is more toward almost to the previous person's comment. Has there been any efforts in terms of documenting or recording service coordination? What type of services was offered? What was successful? What were not? Because housing provision as it stands is very siloed, but it takes a whole system to provide support for them to remain housed. when they're not dealing with mental health breakdowns or acute drug-induced psychosis, there are things that will prevent them from being successful in placement. So that kind of data, I think, is important to have so we can know how to put focus into areas, where we can address better success outcomes.
I think that happens in any number of places. There are services documented in HMIS, but additionally with the sort of advent of the tenancy sustaining services in partnership with the health plans, we're now able to have a learning community and to have sort of a common standards for how we track services and how those services can be reimbursed through Medi-Cal. And the county set up a structure to be able to contract directly with the service providers so that we would set up the administrative infrastructure on the back end so that not every service provider would have to do that. We have expanded to, Jeanette, 19 different providers doing tenancy sustaining and housing navigation services in the county, whereas previously there were only 3 or 4 who had the administrative capacity to do that Medi-Cal billing. Thank you so much, everyone.